नमस्कार दोस्तों, आप सबका स्वागत। आज के इस प्रोग्राम में मैं बताने जा रहा हूं अबाउट डायबिटीज, जिसे हम शुगर भी कहते हैं। शुगर is a disease, is a condition in which sugar level in the blood is raised for a prolonged time above normal values. So without having food, it should not be more than 100. And after food, it can go up to 140 or 145. So if you have had good food today with sweet dish and very rich diet you have, so your blood sugar will be raised. But it doesn't mean that you are having sugar disease, diabetes. So diabetes is only if it's raised for a prolonged time. So why we get this disease, we have to understand that. To treat diabetes, we have to understand that why and how it comes. So the food whatsoever we consume, that converts into sugar in the blood, and that can be measured. And this sugar is actually supposed to be consumed by the cell, by the organs, by the tissue in our body. And insulin is responsible to take that sugar molecule and push into the cell. If insulin is not produced well, then that sugar won't be brought to the cell. So that way, all the sugar is into your blood and cell is not consuming that anymore. So it's quite clear that we have to take care of our pancreas. Much more sugar in the blood means that your cell is not getting enough sugar to function. That's why in Ayurveda we believe that with sugar you can be 100 years of age. Only the complication of sugar that makes your life worse. So because cell is not getting proper sugar to function, so we get complications. Complications like retinopathy, neuropathy, kidney disease, high blood pressure, heart disease. There are so many hidden diseases what we can get with diabetes. So that's why one has to take care of sugar very well. Patient usually ask us that why it's spreading like anything. In early days, there were not so many patients. But now we see that there are so many patients suffering from diabetes. Why? So we in Ayurveda, we believe that this is a lifestyle problem. So it's a rich man disease. Rich man, he who is having rich food and doesn't have to do much physically. Rich food means so much protein, so much fat, carbohydrates, and he is not doing physically much. Then that's why it's a rich man disease. Nowadays we have food with preservatives. A lot of pesticides are being used in the agriculture field, and people are having medicines like thyroxine, like steroids for other diseases, of course. And complication of that is that a sort of xenobiotics is produced in the body, what's going to destruct and destroy function of your organs like pancreas. In early days, we used to use our body. We used to walk. We used to do physical exercises. So we could digest that type of food, but not anymore. So what we can do? You see, if you are a diabetic patient, you must go to your GP. You must take medicine prescribed by him, but you have got an important role to play yourself also. Important role in this, as I told you earlier, that this is a lifestyle problem, then you have to change your lifestyle. Your food should be according to your nature of job. If you are working in a field, if you are doing physical job, then you can have rich diet. If you are not doing that much physical job, you should not be taking rich food. And it's known in Ayurveda which food are rich and which food are not that rich. You see, we are used to have wheat, rice, banana, yogurt, milk products, protein, meat, chicken. These are all rich food. So Ayurveda says that you should avoid that rich food. So what is not that rich food according to Ayurveda? That is buckwheat, kattu ka atta, amaranth, millet, jowar. These are all grains what can be taken in place of wheat, what we are used to. That can be taken in place of rice, what we are used to. And don't forget that you have got legs, that is to walk. So make good use of your legs. So that's very, very important. Take hot water and stress-free life, daytime sleeping. These are a few things what you should be avoiding. So I think for a day it's enough. Take care of yourself. Go to your GP, get your blood checked regularly, and take responsibility to cure yourself. Thank you.